The effect of preoperative exercise, education, and pain control for patients undergoing a total hip arthroplasty. Definition: the preoperative physical therapy and education may be beneficial in promoting quicker returns to function immediately post exercise until the day before your surgery helps improve your strength, range of motion, and resistance. This helps to obtain a successful results and recovery. Application in physical therapy. The physiotherapist will teach the patient respiratory, isometric exercise, and mobilizations in bed using them immediately after the operation, although there is a little evidence to support the use of preoperative education and thus improve results post-surgery in patients operate on hip protests, especially regarding to pain functionality and hospital stay. Pros and cons. Pros is all allow faster recoveries, less bleeding and less pain. Having less bleeding, there will be a reduction in the incidence of decised venous thromboembolic. The initial recovery is faster, but after 3 months, the functional results. Cons. Infection is one of the most serious complications, but currently tense prophylactic measures is given on a very low percentage, just 1%. Post-operation dislocation is the most frequent complication in patients intervened by postural role, with an incidence of 3%. Neurovascular damage. The most important lesion in nervous paralysis external popliteal sciatic, which is something defined and due to the traction under distension with pressures on the nerve with the spacer, or by the different maneuver applied on the line. Hence the great importance of protecting it properly. Issue applied in Ecuador. A study in Ecuador 2014 showed that the family size was the predominant with 55%. The average was 66.3 years, and the growth of the most operative age was 61 to 80 years with 56.4%. In conclusion, the purpose of rehabilitation is to recover the amplitudes, articulate, strengthen the muscles, and eventually modify the marching strength in for a slow evolution. Rehabilitation preoperative is usually useful for preparing soft tissues with a view to the exercise that will be indicated after the operation.